There are concerns tonight about another COVID outbreak as several states report a recent spike in cases. WFXR's Damon Reynolds joins us in the newsroom tonight to tell us if we should be worried here in Southwest Virginia. Damon, good evening.
Good evening, Kathleen. The simple answer is not right now, according to Dr. Cynthia Morrow of the Roanoke City Allegheny Health Districts. Now, there have been 56 new cases over the last week and 1 hospitalization. Now, that's a good sign, but that doesn't mean that we're necessarily out of the woods yet.
Never say never with COVID pandemic.
While things are not bad here, that is not the case in Philadelphia, where mask mandates are being reinstated following a spike in COVID cases. Dr. Morrow says we should still have humility with the virus.
Yes, we are at low levels, but it's still here.
For this reason, Dr. Morrow says people can choose what precautions they take against COVID-19.
Everybody at this point in the pandemic, we all have the information that we need to make the best choices for ourselves.
One of those choices is to wear a mask.
It's really important for us to respect everybody's choices when it comes to masking. I don't anticipate that we'll have mask mandates now that we know so much more about it.
Local residents say they are cautious about letting their guards down.
I'm really tired of the restrictions and how it's dominated the news, but on the other hand, I'm really worried.
The toughest part too is as we're getting into summertime, you got concerts coming up, you got a lot of more public activities happening. That's where you kind of get wary about, like, hey, maybe cases are going to actively bump up.
Skier says the impact of the virus on older people is concerning for his parents.
I'm in great shape, but they're in their 80s and I worry about them.
Now, Easter is coming up this weekend, and of course, families are going to want to gather. Now, Dr. Cynthia Morrow says this is fine and that families should make the judgment that their environment is safe for themselves. Kathleen, back to you.
Damon, thank you.